Endometriosis is a condition where tissue similar to the lining of the uterus grows outside of the uterus. It can affect the ovaries, fallopian tubes, and other areas in the pelvis. This condition affects millions of women worldwide, often leading to pain and other challenging symptoms. Imagine your uterus having a twin that decides to grow in other parts of your body. That's kind of what endometriosis is like. The tissue that's supposed to be in your uterus starts growing elsewhere, and it doesn't behave as it should. One of the most common symptoms of endometriosis is pain. This pain can be severe and debilitating, especially during periods. Women with endometriosis may experience excruciating cramps, lower back pain, and pain during intercourse. Many women also experience irregular periods, heavy bleeding, and spotting between periods. Some women have digestive issues like bloating, constipation, or diarrhea, especially during their period. It's important to remember that each woman's experience with endometriosis is unique. Some women only have mild discomfort, while others have severe pain that interferes with their daily lives. Diagnosing endometriosis can be challenging and often requires patience and persistence. It often involves a combination of approaches, including both clinical evaluations and advanced imaging techniques. It's crucial to talk to your doctor about your symptoms and medical history in detail, as this information is vital for an accurate diagnosis. A pelvic exam can help identify any abnormalities, but it's not always enough to make a definitive diagnosis. Additional tests are often needed. Imaging tests such as ultrasound or MRI can provide a clearer picture of what's happening inside your body, helping to identify any endometrial tissue. In some cases, a surgical procedure called laparoscopy may be necessary to confirm the diagnosis and to assess the extent of the condition. This minimally invasive procedure involves inserting a thin, lighted tube with a camera into the abdomen to view the pelvic organs directly, providing a definitive diagnosis. Remember, you're not alone in this journey. Seeking help is the first step towards feeling better, and there are many resources and support systems available to assist you. Section 4. Managing endometriosis, First Steps. While there's currently no cure for endometriosis, several treatment options can manage symptoms and improve quality of life. Treatment plans are tailored to each woman's needs and may change over time. Your doctor will work with you to find the best approach for your situation. Lifestyle modifications can play a significant role in managing symptoms. Simple changes, such as regular exercise, a balanced diet, and stress management techniques, can make a difference. Over-the-counter pain relievers like ibuprofen or naproxen can help with mild discomfort. Section 5. Advanced Treatment Options. In this section, we will explore various advanced treatment options available for managing endometriosis and related conditions. In some cases, your doctor might recommend hormone therapy to regulate your menstrual cycle and reduce endometrial tissue growth. This can be particularly effective in managing symptoms and preventing further complications. Hormonal contraceptives like birth control pills, patches, or rings can make periods lighter and less painful. These options are often the first line of treatment due to their effectiveness and ease of use. Other hormonal medications, such as gonadotropin-releasing hormone, GnRH, agonists, and progestin therapy, can also help manage symptoms. These treatments work by altering hormone levels to reduce the growth of endometrial tissue. Surgery is sometimes necessary to remove endometrial tissue or adhesions, which is scar tissue. This can provide significant relief from pain and improve overall quality of life. Laparoscopic surgery is often preferred as it is minimally invasive and allows for a quicker recovery. This technique uses small incisions and specialized instruments to remove problematic tissue. In severe cases, a hysterectomy or removal of the uterus might be considered, but this is typically a last resort. This option is usually reserved for those who have not found relief through other treatments and are experiencing severe symptoms. Section 6. Living well with endometriosis. Living with endometriosis can be challenging, but it doesn't have to control your life. Understanding your condition is the first step towards managing it effectively. Working closely with your doctor, considering different treatment options, and staying informed about the latest medical advancements can make a significant difference. Making positive lifestyle changes, such as maintaining a balanced diet, engaging in regular physical activity, and managing stress, can all contribute to living a fulfilling life. Remember that you are your own best advocate. Take charge of your health by staying proactive and informed. Don't be afraid to ask questions, seek second opinions, and ensure you fully understand your treatment plan. Seek support from loved ones, as their encouragement can be invaluable. Or connect with others who understand what you're going through. Sharing your experiences can provide comfort and insight. There are many online resources and support groups dedicated to endometriosis, offering a wealth of information and a sense of community. These platforms offer a safe space to share experiences, ask questions, and find encouragement from others who are on a similar journey. With the right tools, support, and a proactive approach, you can live a happy, healthy life despite endometriosis. Embrace each day with positivity and resilience.